Hello everyone, welcome to another episode. Today we have with us Dr. Shelvin Kumar, nuclear medicine consultant. Welcome, doctor. So doctor, what is nuclear iodine therapy and where is it used clinically?
Radioactive iodine therapy is the therapeutic use of radioactive iodine for diseases related to thyroid. So in this there are two forms of therapy. One is low dose iodine therapy, which is specifically used for diseases such as hyperthyroidism. And there is high dose iodine therapy, which is used in the context of thyroid cancer. So here we have to discuss about thyroid cancer and high dose radioiodine therapy.
So how is radioiodine therapy used in the context of thyroid cancer?
Yes. So whenever thyroid cancer is diagnosed, the first line modality of treatment is surgery. That is, with total thyroidectomy, both lobe of thyroid and thyroid as a whole is removed. So in most of the patients, most of the low risk patients, this surgery itself is curative. But in some high risk patients or in intermediate risk patients, in addition to surgery, radioactive iodine therapy may be needed. So it's an adjuvant form of therapy. That means after surgery, we have to find out that if there is some residual thyroid or some metastatic disease elsewhere in the body. So first we have to do a radioiodine scan after the surgery. So for radioactive iodine scan, when it is done, we have to find out that if there is any metastatic lesion in the neck or elsewhere in the body. So first thing is to do a radioiodine scan, and if such metastatic lesions are there, then we have to treat it with radioiodine. So that is a radioactive iodine therapy. So for all patients it is not needed, but for some patients radioactive iodine therapy may be needed after surgery.
So doctor, are there any precautions or preparations while undergoing this therapy?
Yes, actually before undergoing the radioiodine scan itself, patients have to stop their thyroxine medication for at least 2 to 3 weeks. So this will increase the TSH level. So a minimum threshold level of TSH is needed for undergoing radioiodine scan. So it ensures that radioiodine uptake inside the thyroid cells. So patients have to stop their thyroxine medications, and they are specifically put on a salt restricted diet. That is iodine restricted diet. So foods which will contain iodine. In our area it is mainly seafoods. So seafoods have to be restricted before undergoing radioactive iodine, and then the normal salt which comes as iodine supplemented. So it has to be restricted. So salt is also restricted, and other food items which may contain iodine is also restricted. So after approximately 3 weeks, radioiodine scan is done. So at the time of doing the study, the precaution to be taken is the radioiodine is taken orally. So it is taken as either as a liquid or a capsule. So when radioiodine is taken orally, patient has to be in empty stomach, and even after taking it for approximately 2 hours, patient has to be in empty stomach. So after taking the radioiodine is the radioactive medicine. So after taking radioiodine, there is some specific radio safety precaution which has to be followed. This is not for the patient but for the bystanders, because radioactive iodine, when the patient is taking the radioactive iodine, the radiation will be emitting from the patient's body. So they have to be careful that at least a minimum of 2 meter distance has to be kept between the patient and their bystanders. So after the radioiodine therapy, the patient will be admitted in a radioiodine ward and will be discharged after 1 or 2 days when the radioactive level comes to a low level. And even after the patient goes to their house, they have to follow these radio safety precautions. And if possible, they have to wash their clothes separately, and they are restricted to do kitchen activities, cooking activities for 2 weeks approximately. And if the patient is pregnant, then it is an absolute contraindication for radioiodine scan. And if the patient is a breastfeeding mother, then the radioactive iodine scan is delayed for at least 2 months after stopping the breastfeeding, because considerable amount of radioiodine will accumulate in the breast milk. So it will be restricted for at least 2 months after the cessation of breastfeeding, then patient can undergo a radioactive iodine scan. So these are usually the precautions which are taken.
Do we need to take care of any side effects for this therapy?
Actually, radioiodine therapy is not a new thing. It was there for a long time, actually. So it is a safe and a time-tested and an equally effective mode of treatment. And usually, most of the patient does not complain any side effects. But in some patients, there may be some minor side effects like some mild tenderness in the neck or in the salivary glands, which may be due to some inflammation due to radiation. That can be cured with taking silagogues, like some sour candies which can be used to increase the saliva production. So that can be dealt with silagogues. And most of the patients worry over the long-term side effects, such as if there is any chance of a second malignancy because of radioactive medicine. But usually in most of the patients, there is no such concerns regarding development of a second malignancy. And usually the risk-benefit ratio is very favorable with respect to radioiodine therapy. So patients need not worry over the side effects of radioiodine therapy because it is a very safe and effective treatment modality for thyroid cancer.
Doctor, how is a patient followed up after radioiodine therapy?
After the patient has undergone radioiodine therapy, usually the patient, the next day itself, patient is put on suppressive dose of thyroxine. And the follow-up scan is done after 6 months to see the response of the therapy. So most of the patients, even after 1 dose of treatment, it can be curative. So some patients who have high burden of disease may need 2 or 3 doses of radioiodine therapy. So the first response is assessed after 6 months. So a radioiodine scan is repeated after 6 months, and the patients will be put on suppressive dose of thyroxine. And the patient has to be followed up for lifelong. And radioiodine scan may not be necessary every time, but they are followed with a certain blood test, and they will be under strict follow-up, and they will also be under thyroxine suppressive doses. So what I want to tell to the patients who are having treatment under thyroid cancer for who opt for radioiodine therapy is that they need not worry over thyroid cancer, because it is a very curable and fully treatable form of cancer, and safe radioiodine therapy is a safe modality of treatment, and with proper management we can totally cure the cure thyroid cancer. That's a message for thyroid cancer patients. Thank you.
So with that, we wind up today's episode. We'll be coming up with another topic the next day. Thank you.